considering where or how you will be addressing chronic health concerns with your healthcare plan?
Well, one of them, as you know, having been involved in the organization, is the dramatic and unexplained rise in autism, as you know, and we've got to get to the source of that. We've got to find out what it is. There's profound disagreement in the scientific community about the cause of it. There's no disagreement that it's on a dramatic incline, and the burden that it places on parents and families and institutions such as our educational system is severe. I think that there are 5 chronic diseases for all Americans that consume 75% of healthcare costs, as you know, 5 of them. I believe that we should have outcome-based treatment, and that is that if a healthcare provider will provide treatment for a year for someone with a chronic disease, they should be paid a lump sum, and if that patient, whether it be a child or an adult, is well after that period of time, then they should be rewarded. There should be incentives to keep costs down rather than the incentives which are to keep costs up. If someone has one of those chronic diseases, again, it doesn't matter the ages, we may have to provide a special Medicaid trust fund for the care of those individuals if they are unable to get the sufficient health care they need. Because I want to give every American family a $5,000 refundable tax credit to secure health insurance. So I intend to look at where 75% of the healthcare costs in America are, which is chronic diseases, try to have outcome-based treatment for it, have funding, if necessary, from special sources because of the treatment that are needed, and obviously encourage things like home health care. This is subject for a many hours long forum, as I know you're aware, and I'm not covering this subject anywhere near completely, but let me just give you a small example. My state of Arizona was one of the last states to adopt a Medicaid program. We call it Access. In it, we put in strong incentives for home health care, and rather than institutionalized care. And we, because of those incentives that are provided that are given to the healthcare provider, we have less than 1/2 the number on a per capita basis in long-term care facilities and that are in home care facilities than almost any other state. You see what I mean? We can also provide incentives for quality. I would argue that most families believe that if you can provide home health care, it's a far better quality of life situation than long-term care facilities. Then I think we can put those incentives into place too. We need medical malpractice reform. We need walk-in clinics. We need community health centers. We need a long list of things to be done, but the crux of it all is it's not the cost, the quality of healthcare in America, it's the cost of healthcare in America, and the double-digit inflation associated with it is what we have to attack. I believe in making healthcare affordable and available. My Democrat opponents want the government to do it, what I think families should do. I thank you for your question.